Welcome back to the Chatty Vets Pod. I'm Brendan.
And I'm Charlotte. Thank you for tuning in.
It's officially our second month of being live and out in the ether. Thank you so much to everyone who's tuned in to our previous episodes so far. We hope you've been enjoying the content.
Yes, thank you very much. And welcome back to our first episode in February, our next 2 Week Takedown episode, where we aim to bring you up to date with all the latest news and products in the UK from the last few weeks.
We've got another good show for you today, covering everything from ET tube cuffs, cancer blood tests, discussing difficult cases we've both had recently. But I think we really need to start with the awful Panorama episode.
Yeah, I think we were all a little bit nervous about how this was going to go. And I know most of us have quite a lot to say about it. But I guess before I dive in, what did you think about it, Brendan? What did you think when you watched it?
I thought it was another bad day for BBC journalism because some of it just felt really badly done. Like there's the older gentleman in the park with his terrier. And the interview was basically the guy went, "What do you think about vet prices?" He's going, "Well, I went to the vets and they said it was £200 to £300 to take a growth off his tummy. And then he went to the RSPCA in Wigan and he got it paid 25 quid. You know,
Yeah.
is that anything to do with vet pricing at all?
No. And do you know what? I was actually really, really hoping that the episode would have given the public more of an insight, an understanding about our work, who sets the prices, and basically tried to sort of bridge that gap between our understanding and how the public understand, and, how much pressure the CMA, corporates, all of those kind of companies put vets under. But honestly, I ended up just feeling really angry and frustrated by the end of the episode. Like the fact that, like you say, they interviewed the public and they had things to say like, they don't care about me or my pet, they just want the money. Or don't tell me that they're animal lovers, they just do it because the money is good. None of that helps our case in terms of reminding the public that we as vets don't set the prices and we as vets don't see any of the profit from corporates. This is really stupid, but I got really angry and went on a bit of a rant and went on Google and was like, right, what's the average wage for a new grad vet in the UK? And it's still about 34k. And you think, great, like comfortable salary, fine. But to put it into context, the average wage for a manager, a big supermarket chain like Aldi, is £59,000 a year. They don't need a degree. They don't ever have need to gone to uni. They can go out from school, start working and land themselves, a pretty good job with a really decent wage. So for the public to turn around to us and say that we're money grabbers and all we care about is money, why haven't they spoken about things like that in the episode rather than just having a go at us and, getting those people like that old man in the park to chat about how awful we are and how expensive things are? It just like really wound me up.
I think, what did I like? Susie, president of the BVU.
Yeah, she did a really good job.
Yes,
yeah.
she made the really astute point that we're connected to the public as vets, but the people who own, like you're saying, the owners, the equity groups, they've got no connection to these people. So the pricing and how the management goes is so disconnected from how the clients are feeling. And I think that is one of the biggest issues. And then there's also that Vanessa Waite. Have you seen this woman before?
I've never seen her, but I think she came across really well. She was really fun, wasn't she? And she sort of...
She's brilliant.
If you're listening, you did a fantastic job. So...
Yeah. Oh, she was at London Vet Show.
Oh, was she?
And she did a management-y thing there, and she was brilliant as well. And she put across how, on the emotional side, how it makes us feel, which I thought was a really important thing to say. And because she's a vet in practice, she feels it because she's there talking to clients and feeling how hurt the clients are and how angry they are at us. And she put that across. And she was like, we haven't changed. We're all the same vets that we were 10, 15 years ago. And I love that journalist. I really hate his expressions on that program. He said something like, "Oh, it takes a lot of money to look after a pet these days, doesn't it?" kind of thing. And she was like, "Well, yeah, just get a Jack Russell. They don't break."
Yeah.
And I thought, oh, brilliant. It's so true because we know, don't we, Chuck?
Yeah.
Like how many, we do some PDSA work when we do vets now, don't we?
Yeah.
And you've got Chihuahuas, Frenchies, a whole bunch of breeds that are going to get a multitude of problems. So that is a big part of the cost of a pet.
Yeah. I mean, I remember I once had a lady come in who had a Frenchie that was in dystocia. She was struggling to give birth and she was 2 years old. And the woman came in and said, she's just a pet, but we bred her because we thought it was what she would have wanted. We thought it would be good for her to have a litter of puppies, that classic line. And she said, when I told her that it needed a C-section and it was going to cost between £3,000 and £3,500 overnight, she cried and she went, "Nobody ever told me that my Frenchie was going to have breathing problems when I bought her as a puppy. Nobody told me that it was going to have issues giving birth." And I'm like, where do you think this information is going to come from? Do you think it's going to come from the breeder who's asking you for 1,500 quid for the puppy and go, "Oh, well, wait, just before you buy that, do you realize how many problems you're going to have in the future with this dog?" They're not going to tell you. And like, what do you expect us to do? Do you expect us to, as soon as a Frenchie gets registered on the system, do you expect us to message you and say, "By the way, have you really thought about this? Have you thought about how expensive this is going to be?" Like, where is the accountability of the people that own these pets? Why is it our fault? Honestly,
Hold
I
on,
got,
and add to this, what about the French owner or the pug owner or the whatever that gets another 2?
I know.
Like, so they've now got 3 breeds that might have more multitude of problems, and you can't tell me that it's even more. Well, don't complain about the
Yeah,
cost. You've just got your 3rd dog with multiple health
I know.
problems.
And it's, there's nothing wrong with owning one of those breeds, but you just have to understand what you're getting yourself in for. And I think the thing that I found so frustrating about this Panorama episode is, like, the cost of veterinary care is not going to drastically change from the CMA agreement. It might be more transparent and we might have to reduce the prices of our written prescriptions, for example, but realistically, it's still going to be expensive. So the people that can't afford pet healthcare at the moment are not going to magically be able to afford it in a couple of months' time. So why weren't they pressing the idea of pet insurance? Why did they only mention it in the last 2 minutes of the episodes? Why didn't they say, "Look, realistically, whatever we want to change, pet healthcare is not going to become cheap in the next 6 months. Get yourself insured, and then if something happens to your pet, you will be able to pay for it. Get yourself a lifetime cover insurance. Read the small print. Get a policy that doesn't exclude cruciate ligaments. Get one that pays more than 6K a year rather than only getting £1,000 policy." Why haven't they advertised the things that are actually going to make a difference? It doesn't. I just got so angry. I could go.
I love that. You know, I wrote my points for this section after a couple of beers. We went out last night at about 1 in the morning, and it's all swear words, so I don't know whether to say it. So I put
It's all right. I can click
you can see it on
explicit.
your end, can't
Yeah.
you? Can you see it?
Yeah.
I've got, "Yes, get flipping insurance. Just get it. It's your fault, you dopey twat." But don't know if we should put that in the I think that was just me. I think I was just tired and had a couple of drinks.
Yeah.
But yeah, but you're so right though. Get insurance, and it's so. It is. It's true.
I think it was just they just didn't explain anything properly in the episode. And, don't get me wrong, I get, like, in a half-hour thing that screens, like, there's only so much you can say. But the, there was one guy that initially came across, really sensible, and really honest. The guy that was talking about his dog that went to out of hours, and I think it was a spaniel, and how it sounded like it had had something like a foreign body surgery. That's the impression I got from what he was saying. He'd spent thousands of pounds on an emergency surgery because the dog would have got really poorly if he hadn't have gone through it. And they'd spent, I don't know, I think he said like 6 or 7 grand to start off with. And then he said, and then the cheek of it, a few days later, she got worse. So they told me that I needed to pay an extra £6,000 or however much it was. And he was like, "I was never told this from the get-go. I never thought I'd be able to I'd have to spend that much money, blah, blah, blah." And don't get me wrong, none of us were in the room with the vet that discussed with them the risks, how much it was going to cost, what the prognosis was going to be. I don't think I've ever done something like a foreign body surgery and not said, there are complications. There is a risk that this could break down. There is a risk of septic peritonitis. These are things that they should have been told from the get-go. And if he was told that septic peritonitis is a known complication and things might go wrong, I'm really sorry, but that is a complication that can happen. And I'm sorry that you've had to pay another £6,000, but what do you expect? It can't all be roses all the time and everything's going to go perfectly. But they didn't explain that. They just say, "You didn't tell us from the get-go and you told us that it was going to be fine. And then 2 days later, we had to pay another £6,000 that you didn't tell us about," which makes us come across as awful. If they'd have actually broken it down, we wouldn't seem like such arseholes. But because they don't, they just make it seem like we're money grabbers. And none of this has helped. I don't really get what the point of the episode was. Was it to make people more angry with vets? Like, really frustrating, really frustrating.
I like the way you look at it, because the BBC should be there to educate and enlighten and dig deeper. And that's what I
Yes.
mean by it's another bad day for BBC journalism, because it was purely there just to get viewers so they can, well, yeah, what is the point of the BBC? The BBC isn't meant to be there just to get viewers and advertising, is it?
No,
It's meant to be there
it's
to
supposed to be
educate and illuminate.
it's supposed to be
It's
non-opinionated, but I'm
terrible.
really sorry, but if you don't include the reasons for
Yeah.
why things are happening, it makes it opinionated in light of the public, and saying it doesn't give our side of the story. Just because you've interviewed vets doesn't mean that you've given our side of the story. Susie and was it Vanessa, the other lady? They did an amazing job,
Yeah.
but I bet they said so much more in those interviews that they've cut out just because they thought, oh, it doesn't work with our case of saying how expensive everything is. But we knew how much this was going to affect everyone in the veterinary profession when this came out, and how we will all have something to say about it. So we wanted to get our first lovely guest onto the show. So to get another opinion within the veterinary field, we actually interviewed Kat the vet recently to see what she thought about all of this.
Hello, welcome to Kat the Vet. Thank you for joining us on the Chatty Vets podcast. I'm sure you have lots of followers who are listening and will already know who you are. But for those who don't, tell us a little bit about yourself.
Oh, well, thank you very much for inviting me. I'm delighted to be here. So I am a first opinion vet in small animal clinical practice and have been for quite a while. Brendan roughly knows how long, but I don't mention the numbers anymore because I don't want anyone else to know. I have recently opened my own practice with my husband. So we're a new independent just outside of Sheffield. And yes, I also have a second life in the online space, like you say, as Kat the Vet, where I sort of talk about things that bother me or interest me and try to be a positive voice for this profession of ours.
So, I mean, in terms of your Kat the Vet profile that you have online, where do your main interests lie when you talk about veterinary work and animals?
So my main interest lies, I suppose, in two places. One is this profession, and I love it dearly. I think that everybody in it is phenomenal, and I really hope to be a positive voice for us and to represent us when maybe we're being misrepresented in the media, as has happened quite recently. And then my other big passion is animal welfare and the welfare of the people who own them as well. So talking about, issues that we have with pedigree dogs and extreme conformation, correcting a lot of misinformation. And that annoys me hugely because it misleads our clients and it misleads pet owners. So I sort of have a variety of interests, really. And I just talk about, there's no plan, there's no strategy. I see these things online about, how to grow and pillars of content and all these things that these people do. And I'm like, oh, I just talk about things that interest me. And some weeks I talk about loads and some weeks I barely do anything. But it's going well. And it's a string to my bow and it keeps me out of trouble for sure. Well, actually, that's not entirely true. Sometimes it gets me into trouble, but most of the time it's a really positive thing.
Yeah, great. And I think it's great because you're starting a discussion, you're bringing people together, you're starting discussions, you're getting people thinking, which is great because I think, like you say, a lot of the general public as well will take what they see and hear in the media as gospel. And I think actually starting that discussion and talking to people from our point of view as well can be really, really useful. And I guess that sort of segues us into chatting about that big recent Panorama episode that aired on the BBC. And I guess obviously last year and still now the CMA report and generally the pricing in veterinary work is now a massive thing in the media. But I mean, how have you found it both online in terms of your online presence and in terms of clinical practice? What do you think of the episode?
So we're very fortunate in the practice that we work at that we haven't had very much kickback in real life. And I think in terms of the proportion of the kickback you get in the online world versus real life, it's night and day. Yes, you get the odd comment. And yes, I think some people probably suffer with it more than others in real life. But I think the vast majority of the time our clients see through the media storm and genuinely appreciate what we do and are quite, they're sort of on our side, really. But obviously the online world is an exceptionally different place, one where people are far more combative and say things that they would never dream of saying to you, to your face in the real world. And so it has been really tough. It's really tough to read the things that people write and think is acceptable to write. Now, they're expressing frustrations, they have misconceptions, people are cruel and mean on but it's just so hard for us all to read these things about how we don't care and we're only in it for the money, and we're denying pets treatment and that sort of thing, and it hugely impacts on the welfare and the mental health of the profession. And I think that is massively underestimated by the media, but they don't care because it's a good story, and tomorrow they'll be on to somebody else. So we have to fight our own corner because no one else is going to.
Yeah, exactly. And I think that's what we were saying and we were discussing this episode, Brett. It feels like it was aimed to get the public more enraged about it and to get viewer numbers up rather than to actually help people see things from our point of view. I don't know whether the episode made you feel a particular way compared to how you normally feel online. Did it upset you more or less, or were you just like, oh, it's just another thing, another day?
Just thought it was actually genuinely quite poor journalism, and it was really sensationalist, which you try to expect, you sort of expect better from the BBC, but they're not doing fantastically well at the moment. But it was like, sort of harking back to James Herriot and operations on his kitchen table, which is completely ridiculous because nobody in their right mind wants to go back there. And, and then people there were so many holes in the stories of the pet owners. So, I have sympathy for the pet owners who were featured. I'm sorry that their pets are poorly. I appreciate the difficulties that some people have with, meeting veterinary bills. But every single story that was shared, there will have been vet professionals up and down the country screaming at the TV, picking, going, well, obviously your vet didn't tell you that, or other options would have been discussed, or that's actually a bargain, £2,000 for an MRI. Where can I send my patients for that? Because that's half the price of the vast majority of them. Or, if you lose your pet and it's awful and the stressful situation, but the answer is not to, get cross after the fact and accuse professionals of doing things that in the moment they didn't do. And so I think that's the problem with a lot of the time when these things are presented in the media, whether in that program or in radio shows or TV shows or whatever it is, they rarely have a vet on to sort of say, well, actually, I think maybe you're misremembering or representing this story in a slightly unkind or unfair way. But of course, it's really hard because if a vet was to do that, we would never want to upset anybody like in that space, would we? So our answer is always, well, I'm really sorry that happened to you. I'm really sorry you feel that way. I don't think many of us would stand up on a radio show and say, well, actually, I don't believe you. Or actually, I think that you're maybe misremembering that story. And, so it's really hard to get a balance, but that is always what is missing. Always. And when you work in the profession, you can see where those holes are, but you would never want to point them out in real life because all you're going to do is upset somebody. And we work every day to not do that. Our job isn't about animals, it's about people. And we're actually really good at communicating. And I think we often underestimate our skills in that area.
Yeah. And I do agree with you as well. I'm glad you saw it as bad journalism. I think us as vets saw it as bad journalism. I do think that, I don't know how many of the public appreciated it was bad journalism. Do you think most of them see it, or just a minority?
I think the public see the world through different eyes than we do. And so I suspect not. I think probably most people took it at face value. Memories in media are short. So it's not so much the show itself, it's more the conversation and the feeling that it contributes to. So there seems to be this very anti-vet feeling within the media space at the moment. And so it's more of it's a feeling, isn't it? It's not I don't think specifics would be remembered by anybody other than like the vets who could pick it apart piece by piece. But it's like the concept, isn't it? And the overall impression that people get. But the problem is it creates such a lot of conversation online. So if you look at the stories, because we've had the CMA, we've had the DEFRA announcement of the consultation of the VSA, which shamefully, in my opinion, led with pricing, which has never been a big part of the VSA, but they led with that because they knew they would get attention. And so in the past few weeks, we've been absolutely battered. But if you look at any post that's released on any news agency, whether it's the BBC or your local paper, with a syndicated story, there are hundreds of comments and loads of engagement. And so they're just they're leveraging us for engagement for themselves. And, tomorrow they'll be on to something else. But the aftermath they leave in their wake of the damage they do to us and our colleagues is just awful.
Yeah. And I think you're exactly right with the media, are running with what's big at the moment, because there was a point where it was more discussed in the media about vets' mental health and the fact that in the profession, because we deal with euthanasia, we deal with really tricky conversations, our mental health is a big thing. And it's known that across the profession, that is a real issue. But that's not the story they're running with, because it's not the thing that's selling at the moment. It doesn't matter that the episode that they've aired might have affected people so much, especially the people whose cases they were, those people that have gone on there and bashed the vets that they spoke, that they had dealings with. Those vets will know who those people are, and the emotion that's left behind, that's not being mentioned. But that's still a newsworthy story, and it still has a lot of emotion behind it, but it's not what's being run with at the moment, because it's not the biggest thing in the media and it's not selling stories, is it?
Yeah, you're absolutely right. I hadn't really thought about that. But yes, somewhere out there is a vet who knows. Well, not only are they watching themselves sort of effectively be slandered online, even though they're not being named, they know the truth behind the story and can't tell anybody. And, maybe that client will walk back in the door with a puppy in a few weeks' time and completely think that that's okay. And yeah, and it is great when our mental health is discussed, and it is a challenge, but that has to always be very carefully presented in the media to make sure that we don't inadvertently put out the wrong messages about that and normalize that kind of thing. But you're absolutely right. Every so often there's a positive story, but positive news stories don't sell. If you think about it dispassionately, the news isn't about positivity, it's about negativity always, because that is what grabs the attention. We're not unique. We just feel it more because it's us. We don't notice when it's the doctors or the dentists or the politicians,
Kat, do you think it's opened up the gulf between independent practices and corporates more? Because I'm detecting that a little bit in the consult room.
Yeah, I agree it has. And now, as the owner of a new independent practice, we certainly gain a lot of clients because we're not a corporate. And I really have tried very hard in all our marketing about the practice. We talk about how we're independent, but we never talk about how, we never talk about corporates. We never say we are not a corporate. We just say we are an independent, because we're all in the profession on the same side. And I do think we have to be incredibly careful amongst ourselves that this doesn't set us against each other, because that's absolutely not what we want.
Yeah, exactly. And I think Brendan and I especially have probably found there's loads in emergency work before. It's like if you get referred a patient for overnight care and you think, oh my God, why the hell has that vet done that? But you're never going to say that to the client. You're never going to say, what have they done that for? What are they talking about? Because you're supporting your colleagues. You say, I think we're just going to change the plan a little bit here. This is what I'd like to do for these reasons. And you keep that positivity going. So we need to be there for each other, really, don't we?
Yeah, absolutely. I think you guys in emergency and also in referral do sometimes walk a very fine line. I sent a referral request in for a patient this week, and I sort of told them what I did. And then I put in brackets, please don't judge me, but this is what I did.
Yeah.
But they're lovely, and they wouldn't. But it's true, sometimes decisions are made that you think, oh, that's an interesting one. But, you weren't there at the time. You've no idea what happened, really. And essentially, we're all singing from the same hymn sheet. So, yeah. But it's a very unique position that you guys are sometimes put in. That is another, very delicate balance to strike.
We'll hear back from the wonderful Kat the vet in a bit to discuss difficult cases, but for the moment, let's leave the CMA and the money issues behind us and move on to some more fun and clinical stuff. So I thought it might be worth talking about these cancer blood tests, if anyone's using them yet.
Do you know what? I've never really thought about these in practice, but I did see them mentioned a little while ago, I think in the Vet Times or something like that. So are there now cancer blood tests that we can use to check for biomarkers in the blood or something like that?
Yes, there's an in-house version by Antec, which, to be honest, looks the nicest one to use, but you have to have their in-house lab system, which I guess most of us aren't going to have, or you can send it to a variety of reference labs. But I don't think it's terrible, but you have to separate it within an hour and then send it on ice to arrive within 24 hours, which is slightly annoying.
I think it sounds like the concept itself is really promising. and potentially something that owners can really get on board with. Because I don't know how many times you've had it, but when older dogs are brought in by their owners and they say, we think something's wrong, we want you to tell us if it's got cancer. And I'm like, well, does it have any GI signs, or is it losing weight, or is it coughing? And they're like, no. Yeah, oh, good. Should I just scan the entire dog? Where do you want me to look? In principle, there are the clients that would be like, yes, blood test for cancer, perfect. I had a little look, and there's it's NuQ. It's like NuQ blood test by Nationwide. Apparently they use like a fasted blood sample, get sent to the lab, and then they can test for multiple different cancers in dogs, not cats. This is, I think, including things like lymphoma, hemangiosarcoma, and apparently it says it can detect cancer even in the early stages. Apparently it says something like it measures the level of nucleosomes that are circulating in the blood. So when a patient has cancer, nucleosomes from those cancer cells are released into the blood and can be measured using antibodies that are specific to nucleosomes. But the thing is with it is that they say that the release of nucleosomes is common to many different types of cancer, and the test doesn't differentiate between the types of cancer at all. So we'd still have to do loads of investigation to go looking for the source and the type. So basically it's going to say, yeah, we think it's got cancer, but that's it. And we're like, oh, good. Well, is that cancer of the gut, or is it cancer of the chest, or where are we looking? So I think we still need something to bridge the gap between having that result and going for a full body CT rather than knowing where we're looking, I guess.
And going back to that, isn't that also one of those things where if there's some like tremendous sepsis or trauma or immune mediated disease, you could potentially get some overlap with those elevated nucleosomes?
Yeah.
Then, so because I don't think they had another part of the study group that were really sick patients. So potentially really sick patients might trick you into thinking they've got a cancer.
Yeah, absolutely.
Potentially.
So realistically, it's only useful in healthy animals as far as we're aware, because we're not expecting them to have a problem. So if we find a problem on the blood test, we can say, okay, it's very likely to be cancer related, because it's unlikely to have sepsis and have no clinical signs.
It's actually a screening test for the older patient
Yeah,
in
yeah.
a healthy individual. But then you've got that really nuanced thing that it's a screening test, but it misses a load of cancers.
Mm,
So they have to understand that a negative test doesn't mean the dog hasn't got cancer,
no.
which to some extent, what are they getting out of it? And
Yeah, and
that's a tricky
the
one.
really annoying thing as well with it is it's not a black or white. It's not a yes, it's got cancer, or no, it doesn't have cancer from the results either. It comes back as like a grading. So it comes back as either low cancer suspicion, moderate cancer suspicion, or high to very high cancer suspicion. So, like, when are you worried? Are you worried at moderate, or are you only worried at high or very high? If we're thinking, okay, like we get this blood test back and it comes back as saying, okay, very high or high suspicion of cancer, what does that mean? Where do we go from there? Are we sending all of these patients for a full body CT? Are we doing full abdominal ultrasound and chest x-rays?
Yeah, and we're gonna have to have some really careful client communication about this
Mm,
because I can see them getting really peed if you do chest X-rays and abdo ultrasound after a moderate elevation and you don't find anything. Where are you then? Because you've got this moderate risk that there could be a cancer that we're missing.
yeah.
And like you say, well, what do? Do you send them for a whole body CT?
Mm,
You haven't got any symptoms, so you don't know where to look.
yeah.
So it really does need really careful communication in that situation.
And I don't know. I think there could be some really good benefits from it, and we might see those early stage hemangiosarcs on a spleen that we can do something about before they spread. There's definitely those cases where I think it could be really useful. But what I don't want it to do is to make us go looking for things that potentially aren't there and making clients spend a lot of money and putting animals through a lot of testing when realistically they might not need to be. So I do wonder if maybe we should be holding off and waiting for those, because I think eventually we will get those tests that are more specific. Like your cardiac pro-BNP testing, you're looking for myocardial damage. So you can say, okay, if that comes back elevated, you're saying that we think there's something wrong with the heart, right? Well, if we could have tests for, say, hemangiosarcs in the spleen, if they can eventually find a biomarker that says we are or we are not worried about this particular type of cancer, perfect, super useful. Like prostate cancer in people, there is a specific marker that we can look for to say, are we or are we not worried? I just worry if at the moment it's still just a little bit vague.
I think you've got it. On a plus point, let's say you got a positive, you did find a splenic mass and you operated before it ruptured.
Yeah.
So as I think with the right communication, you can see there's some value there,
Yeah,
but
definitely.
it's a very tricky thing to negotiate your way past.
Okay, well, maybe moving on from cancer blood testing, maybe let's chat about something we do every day. So, pre op testing in animals prior to anesthesia. So, I know generally the practices that I work at will usually offer like a hematology and a prep profile or 6 slide, whatever you're using, for any GA, apart from like a cat castrate, obviously. But what do you think? Are you doing them routinely? Or are you doing PCV total solids? Or what are you running pre op?
Nearly most of my clinics will do a basic hematology and a really basic biochem without electrolytes typically. I think the odd one does one with electrolytes. And the hematology for me, I've been out of general practice 5 years. This year, I feel like that's much more common now, and I quite like it, but it's really annoying and how frequent the platelets are low for me.
Yeah.
Do you get this a bit?
Yeah. But do you know what? I think yes, they can be really low, but I think for me it depends how low. Like if you're using the ones where your baseline is your lowest normal is 150 and then it comes up as like 110, I'm not that worried. It's probably clumping. If it comes back as 50, I'm doing a smear and checking that because I've been caught out a couple of times where I remember this. Oh, it was awful. I remember this really horrible case when I was locuming a
No.
couple of years ago. Yeah. And
Oh my God.
they it was an English bulldog that was 18 months old. She was gorgeous, bless her. And she'd come in the day before to a branch practice to where I was working. And she had vomiting and diarrhea and pyrexia. And she'd gone in, the vet had had a look at her, taken some bloods. She was I think she was a little bit anemic, but really mildly. But her platelet count was 10, and the vet ignored it because they said it's clumping. So they put her on medication and sent
Wow.
her home. Yeah. They sent her home. She came back into me the next day with a raging fever. I think she was like 40.5 or something. Her heart rate was through the roof. She had massive submandibular lymph nodes, like massive. I think,
Interesting. This is
yeah,
different.
I think her
Go
PCV
on.
was like, I don't know, maybe like 20%, but her platelets were still through the floor. I did a manual smear. She actually had no platelets. Anyway, long story short,
Yeah.
turns out she had peripheral lymphoma with secondary IMHA and IMTP, and it had been completely missed. Yeah.
Oh,
But so I think it's, like don't,
that is a
yeah. I mean,
bit of a miss.
don't get me wrong, like there are exceptions, and that's definitely one of the exceptions. But if it is low, just check that it's definitely not actually low because you don't want to
Yeah, but
miss
that's
that.
why it's annoying.
Yeah.
Yeah, but then or you say if it's yeah, I know for like 50 is like the clinical cutoff for where you can get bleeding issues,
Mm,
but if it's 80 or 90, I still feel a pressure to then do look at a
yeah.
smear, which is just an annoying amount of my time.
Yeah.
Um, and that's why I find it annoying, I suppose, because really it's usually clumping, isn't it?
Yeah.
Or, you know, you get those cavaliers with the macro thrombocytopathy, or I
Yeah.
don't know
Yeah.
what you want to call it, where they have big platelets and it gives them falsely low platelet counts.
Yeah. Yeah.
You'll have had those, I guess, would you?
Yeah, I think it's if it's high, I'm not worried. If it's low, it depends how low. If it's just a tiny bit low, I'm not worried. But if yeah, for me, it's like if it is less than 100, I think it's prompting me to say I should be checking this because if you're about to cut that animal, you don't want to get that wrong. You don't want to get halfway through an op and be like, oh my god, why is it so oozy? And then you're like, oh, shit, it's got no platelets. Probably should have double checked. Like this. It's probably something that we should be doing before we check. But anyway, I feel like we've gone on a massive sidetrack.
Yeah, where were we going with pre-op bloods?
Oh, the I guess it's how useful it is in terms of what we do with the results. Because if you have, I don't know, a really healthy 1-year-old animal that comes in for neutering and you get a mild elevation in BUN and creatinine, right? Okay, is he just dehydrated? And is it sort of a pre-renal azotemia or is there actually a problem?
I work at a clinic where people are pretty well off and they like the perception that everything's been thorough. Because I don't think it was ever pre-op bloods for neuters was not really a thing, I don't think, for a long time.
No.
But at this clinic, they'll often do pre-op bloods for neuters, and the clients will go away really happy because they feel like a proper job's been done. So you've got that side of it as well. So it's horses for courses, isn't
Yeah,
it?
definitely. And I think there have been the odd one where, I don't know, I've had an older dog in for lump removal or something, and I found it's got like an absolute massively elevated ALP or ALT. And I've called them and said, do you want me to do an abdo ultrasound first? Do you want me to have a check of the liver? Or do you think it could be Cushingoid? If its ALP's through the roof, like, is it drinking a wee more? And they're like, oh, yeah, maybe. And then I'm like, well, maybe we should test that and get that stabilized first before I go chopping lumps off. So I don't know. I think it 100% has its uses. I think the places where I've been caught out is when it's been really young animals where it feels like we know we're probably not going to find something. But when we do find something minor, that's when people get pissy because they feel like they've spent lots of money doing something that wasn't necessary, if you want to call it like that. But I think the people that do want to do everything and do have the money or have them insured and say, yeah, great, great, go for it. They love it because they feel like they've had a really good service. But I guess it just depends on the client, doesn't it?
On the subject of blood testing, this is a bit of a confessional because I only realised when a nurse mentioned it to me, and then I looked it up about a month ago. Tell me if I bet you know this. Shadashans have higher hematocrits than normal dogs. I bet
No.
everyone knows. This
No,
is
do you know what?
horrible. Am I going to get?
No, I don't think I knew
You
that.
don't know
No.
that?
Sight hounds,
Oh
yeah,
my God.
100%. Like if I have a sight hound with a high PCV, I'm like, "Pff, yeah, whatevs." But no, mini Dachshunds, I didn't know that. So
Thank
maybe,
God. I'm a little bit worried that everyone's going to be listening going, oh my God, he doesn't know the miniature Dachshunds.
well, we
But
both
anyway,
don't know it now, so that's fine. So we both know now.
yay! Right, well, it's a lot worse. It's a lot worse because the confessional doesn't end there. Because so what basically, you know how miniature Dachshunds in out of hours, they all come in with hemorrhagic gastroenteritis,
Yeah,
so they
yeah.
go bloody poo, and they're like, there's quite a few of them. So I'd always do the exam, which is always dangerous because they're ready to bite your fingers off. The vitals would sometimes be normal, but I'd always say it's always worth doing a blood test in a miniature Dachshund with HGE
Yeah.
because it's amazing how often the hematocrits are elevated. And I said that to about 15, 20 Dachshund owners over the years.
Yeah.
And this is really bad, isn't it? Should this be public?
I
I don't
mean,
know.
how
But
much?
I didn't know
But I
this.
mean, how much is their PCV normally elevated compared to normal?
Yeah, no, often 70s. And
Really?
I'll be like, I'll come back to the owner and I go, no, sorry. My HGE ministration cases would often be 70 or whatever when I did the bloods. And I'd go back to them and go, look, see, dog seems fine, but the hematocrit's up. But I think I had a little bit of comfort. I think in a healthy, normal ministration, I think the hematocrit can be like 60
Yeah, fine.
or something
Okay.
like that, but it's still up.
Yeah.
But I can't recall exactly what numbers I was getting,
Yeah.
but obviously it was significant enough for me to spot the pattern. Yeah,
Yeah.
it's weird that miniature Dachshunds and greyhounds and sighthounds,
Yeah. Or maybe we'll try and find a
how can
paper.
those two be connected?
Yeah, maybe we'll try and find a
Yeah.
paper, or if anyone has any evidence that's listening to this and wants to post it, then do get in touch and we'll post it on our socials. But yeah, that's really interesting actually. I didn't know that. I mean, I know that, if I have a dog who's like 57, 58%, I'm like, is it elevated or is that normal for you? But I think 70, I think you are well within your right to admit that dog. So I think that's fine. I don't think you have to worry. Anyway, right, moving on from blood testing. Something else we use every day, ET tubes, cuff inflator gauges, and whether you should cuff cats.
I've been locuming and 2 clinics are using cuff inflator gauges. I think most aren't.
Yeah,
But
I don't think
have
I've
you
ever.
had this?
No, I don't think I've ever seen one. To be fair, I don't think anywhere that I.
You've
No.
never seen one? Do you know there's things we do which I don't think they make any difference, but they make you feel clever and like you're doing something really good.
Yeah.
And I think cuff inflator gauges definitely fit that because you put it's the simplest little thing, little plastic. There's different ones, but the ones I've seen have been like a syringe with color coding, like red, yellow, green, or something like
Yeah.
that. And you just press it till you're in the green. I think I can't. The little thing, the little thing inside moves into the green, and then you know
Huh.
you got the right pressure,
Oh,
or
okay.
roughly.
Oh, okay.
And they're not expensive because
Yeah.
I think you're going to lose them and drop them and whatever.
Yeah.
I don't think they're expensive.
Yeah. I mean,
This is one.
to be honest, I'm a bit like, how much place does it have in dogs? Like, how much trauma to the trachea are we seeing by overinflating them? And I guess if we're underinflating them, we're knowing because you're smelling ISO, or your anesthetic's not as good as you were hoping to, or whatever. There's other ways that you can see. But in cats, interestingly, when I was reading around us talking about this on the podcast, so I have never cuffed a ET tube in a cat. I was always told at uni, don't ever do it. It's sacrilege. Don't do it. You're going to kill the cat. No, that's dramatic. But like, just don't do it. You're going to cause so much trauma to the trachea and, you should never cuff a cat. But I feel like now there's more of a debate about it. And I think that potentially, if there is more of a debate about it, that's where these pressure gauges could come in. Because if we are cuffing cats, then maybe we should be using a pressure gauge all the time, because then we know that we're doing it as safely as we possibly can. I mean, are you cuffing them regularly or not?
Yeah, similar experience to yours. For 24 years, I didn't cuff. I just used the cuffless ET tubes.
Mm.
And I find you can slip in, you can get, that's a bit dodgy. You can get a bigger one in. So
Bigger the better,
than if you
Brendan.
have, exactly. Then if you have the cuff that's not inflated, it gets in the way of getting it in a bit. So I end up, so now I don't know if it's because I'm not used to ET tubes with a cuff on, because I'm so used to cuffless ET tubes,
Mm.
and I'll get a 4.5, 5, 4 to 5 easily into a cat,
Mm.
unless it's really little. And it works really well in my hands. And
Yeah.
so that's where like you, I think. But now I'm using a lot of clinics, I'm finding will want to use a cuff. So something new has happened that neither of you, me or you, have heard about.
Mhm.
Um, and I'm only able to get a 3.5 or 4 into cats. And I don't know if I'm not quite got the competence yet, but I'm finding that the empty cuff is sticking a bit more. Have you had this
Yeah,
experience?
I mean, I always find that I try and get a 5 in my cats uncuffed, because like I normally try and get a 5 in. Yeah,
Cuffless, yeah.
cuffless. Yes, cuffless. But to be honest, in those tiny ones that you're neutering, then yeah, maybe like a 4, 4.5 would be something I'd put in. But I just generally have never cuffed them, because I thought that's what we should be doing. But actually looking into this, so there's a couple of sides to the story, because we all know that cats have a higher chance of laryngospasm and tracheal injury than dogs. And there was a paper, I think it was Macmillan and Darcy, I think I've got it in my notes, in 2016, it stated that airway complications associated with anaesthesia are almost twice as common in cats, so 9.4% compared to dogs, which is about 4.9%. But apparently, there was a paper that came out by Yates et al. In 2020 that said, this is going to sound a bit boring because I'm going to read it, but it says a cuffed endotracheal tube may improve the airway seal, makes sense, in anaesthetized feline patients compared to the use of an uncuffed tube, which may improve capnography and decrease theatre pollution with volatile agents. However, there's two significant risks. Overinflation could occur with associated iatrogenic tracheal damage, which could be prevented by using those pressure gauges that you're talking about. And secondly, as a report of the improved seal, barotrauma may also be more likely with high gas flow rates and assisted ventilation. So I think what they're basically trying to say is potentially cuffing cats could be a really good idea, because we know that it's going to help us in terms of our anesthesia and the safety of those patients under anesthesia and the safety of us in the room with them under anesthesia. But because it's more risky in terms of the laryngospasm, I think maybe we should be doing it in clinics that have the access to better monitoring. So those, inflator gauges, and thinking about how, I don't know how we'd even be checking for whether we're causing barotrauma and, what we'd be looking for. But yeah, so I think it's just more of a conversation that we should be having now, rather than saying, yeah, it's definitely something that we don't do.
The other thing which when I was looking at this was 10 minutes after you've intubated them, the trachea kind of relaxes a bit more
Mm.
and you get a little bit of a leak after that. So with, at least with the gauge, you could be checking it periodically through the anaesthetic
Yeah, every 20 minutes or
and
so, yeah.
keeping the pressure.
I think as long as you're being careful, whatever you're doing, I definitely wouldn't be cuffing them if you don't have those pressure gauges, because you've got no idea how much trauma you're causing or how much you should be inflating them. I think they actually said something about the type of ones that you should use. It should be the low pressure, I think it's low pressure, high volume rather than high pressure,
Yeah,
low volume.
yeah,
Is that right?
yeah.
So, because then you're spreading.
Well, is this the difference between the red rubber or the
I think so.
clear plastic
Yeah.
one?
So the
The
type of
clear plastic
yeah, the
ones are the low
type of cuff,
pressure.
because you don't want that focal pressure on the trachea. You want it sort of more spread so that you've not got as much trauma in one particular place, I think is the principle. So if anybody has any stories that they want to share, or any papers or anything that they found that they think would really help in terms of helping us make that decision as to what is the best thing to do in practice, what we should be doing, then please feel free to comment in, because, if there really is a way that we should be changing our practice, then we should be knowing about it.
Should we do some stories of tracheal tears in cats? Just have you got anything that? Have you had this?
To be fair, no, I don't think I've ever had one. No.
Okay, I've got a few. I've had 3. These are tracheal tears from trauma. So the cats come in and they've had an unknown trauma from the owner's perspective, and they, when the trachea tears, you get air under the skin.
Mm.
So basically they've come in and they look like a balloon. It looks like someone's literally had a bicycle pump and they've pumped the cat up, and they're like round, and the skin is stretched about 2, if not 3 inches away from the body, all over their body.
Yeah.
So have you never seen?
No,
Never
I've never seen it.
this?
No, I've
No.
heard about it, but just never seen it.
Oh, I've got X-ray. Oh look. Oh no, I have to say I've got an X-ray of this, and you're going to kill me because on our deep dive into dyspnea, you've got about
Yeah.
X-rays.
Yeah, you'll hear about this in the next episode. But yes, I basically say don't
Oh
X-ray
my
your
God.
dyspneic cats. Yeah.
So anyway, I've got an X-ray. This is terrible evidence, and it's amazing because you've got the thorax of the cat in the middle, and then you've got this, I don't know, 2 inches or whatever of gas, and then you've got the skin right at the edge, and it's crazy. And IV access is difficult because the air's coming down the limbs, and you can't get yourself into the vein very easily when they're that bad. So I've managed to have a few of these cases over the years, but that doesn't mean I know what the heck to do with them. All I can say is when I've been on the VIN message boards years ago, I remember the vet saying that she had a tracheal tear post-dental, and the specialist came on and said, don't worry, they're usually mild, they usually self-seal, as long as the cat's not too bad, things are good, da-di-da. And so I'd had these experiences with these tracheal tears up from trauma. I couldn't see any other major trauma on these cats, by the way, but that was the presumption, and I'd thought they all going to die. So if you do get a tracheal tear and you start feeling subcutaneous emphysema under the skin, don't panic, because most of them aren't like the cases that I saw. That's what I wanted to get across.
Yeah, I guess it depends on how big the tear is and whether it needs repair, or, like you say, whether it is going to self-resolve. So, but I guess if they're not dyspneic, then do you really have to do much about it? If they're oxygenating okay, then do you just sit and wait, But interesting.
Yeah, I think there is a bit of that. I also did wonder if you could, but I don't think this would work, but in my head I thought, could you put an ET tube in so that you're kind of sealing the hole from the air?
Probably,
But
yeah.
then you'd obviously have to keep the patient anaesthetized
Yeah.
for ridiculously long amount of time. So that was probably a rubbish idea.
Yeah. And I guess the thing is as well is that if you're going to keep them anaesthetized, you need to know where the leak is. But how are you going to know where the leak is without advanced imaging or actually going in and having a look? So, to be honest, I think ultimately in the majority of cases, if you've got one that's struggling, then you'd help it as much as you possibly can and refer. And if it's not struggling, then I guess you'd say, let's just see what happens. Keep it hospitalized, keep an eye on it, and just see what happens. Yeah.
Get on the phone to the specialist, your local specialist.
Help me! Yeah.
Yeah, terrifying. On the note about the cuff gauges, by the way, I think it is a little bit of an issue for owners when they get a dog that's a bit of a sore throat. I think we always brush it off and go, well, yeah, that's from the ET tube, don't we? But the owners see it and hear it. So would everyone with a cuff gauge not have the sore throat?
I don't know.
We're a bit blasé about that.
Yeah, I think as well, I've started changing my practice I don't know whether you do the same, but whenever I do a scale and polish in dentals, when I first qualified, I never used to, like, obviously they had pain relief when they were under anaesthetic, but I never used to give them an NSAID because I used to think, well, I'm not doing anything painful. So, but now I think well, obviously there's going to be inflammation in the gingiva where I've got the scaler like right up underneath that gum, but also we are sticking an ET tube down their throat. Like maybe we should be giving them anti-inflammatories because their trachea is going to be inflamed where we've intubated them. So maybe even for those ones that are going under for X-rays or dentals or something where in theory it's not painful, but maybe we should be giving them like 24 hours of anti-inflammatories unless it's contraindicated, because maybe that would help. I don't know.
Okay, well, yeah, we've covered a few clinical tips and discussions, but maybe it's time for some of reflection about some of the cases that have gone wrong and what we'll do differently next time. I, about 3 weeks ago, had a routine. It's always the routine ones that are worse, I think. A routine cat spay, and the photo came through from the owner on about day 7, and there's a lot of swelling there. So straight away you have that negative sinking feeling in your tummy,
Yeah.
because first thing is, was it my op? And then when you find it is your op, it's a shit feeling. Anyway, it came in on my ops day, and my boss was actually very good about it. But I know what he's like. He's so on it with everything. He's brilliant, and I was a little bit gutted. I just assumed this little hernia on the flank cat spay was because one of my stitches must have broken or something. But when I opened it up, weirdly, the stitches are all in place, but a little bit of mesentery had kind of come through like a 1-2 millimeter gap between the stitches, and then just kind of was sitting between the skin and the muscle layer. So I kind of tucked it back in, oversewed it a bit, and then the cat was fine. But it doesn't stop you feeling a bit gutted for a period of time.
Yeah, but these things happen. It's routine complications, isn't it? And the fact that you found it, you fixed it, you did something about it, that's the thing that matters. People know that there are complications in surgeries, and it's gutting when it happens and it's horrible when it happens to you, but that doesn't mean you've done a rubbish job. It just means that and you've done a good job in that you've found it, you fixed it, and you've done something about it. Nothing goes perfectly all the time. It's just really frustrating when it's your own case, isn't it?
Yeah. Do you know what? I was really pleased. That's a really good. You put that point that it did feel really resolving for me to do the repair, and for me to talk to the client, and for me to send the client out.
Mm,
And I just apologized to her and just said, it really shouldn't happen. And I'm
yeah,
really sorry. And she was like, oh, like, because I think she felt guilty, because obviously they're young cats and they belt around the place. And she was like, "Oh, but yeah, she's really crazy and she dives around all the place." And I think she felt some responsibility.
yeah,
But I was kind of like, "Well, no, but it should be good enough to withstand that, really." You
yeah.
know,
But but these
she probably needed to counsel me.
no, but these things happen, and I think perfectionism is it's a really big issue in vets as well, isn't it? It's something that we all struggle with, and I think most of us aren't happy with anything unless that we feel like we've done the absolute best that we possibly can. We wanted to sort of bring Kat the vet back in here into the discussion to chat about some cases she struggled with previously, or any issues she's had in the past with perfectionism, imposter syndrome, etc. So, over to Kat the vet. We chatted about CMA, money issues in the veterinary profession, the Panorama episode, etc. But we wanted to take some time at the end of this episode to discuss some of the mental health challenges that we might deal with in our profession. And we know that things like imposter syndrome, perfectionism, they're issues that vets tend to struggle with generally, among other things. And have you had any experiences with these before, or any specific cases that spring to mind that you've struggled with after the fact? Or
So, yes, and it was quite recently. I had a cat develop a retrobulbar abscess after I did a dental on it. And I have done a lot of dentals on cats over a lot of years, and I've never had it happen, ever. And I jinxed the gods because I'm really trying hard to get better at dentals. And this dental went so well. I actually said to the nurse, "What a great dental. Wasn't that good?"
Yeah.
And all the roots came out absolutely fine. The x-rays, the gums came together. It was just beautiful. And then 2 days later, this cat's face started to swell, and she ended up at our out of hours provider. They had to sedate her, and pus came out of the back of her mouth. And I was devastated, absolutely devastated. The owners have been phenomenal. I've just been so wonderful about it. And, I've just been like, well, complications happen, don't they? And they've been great. But now we own our own practice. We've been able to provide all the post-op antibiotics and everything, because obviously she's been on antibiotics for ages now, free of charge. So we haven't charged them for anything like that. We've not, and we've been quite open. And I posted on one of the veterinary forums on Facebook, because I was like, I have no idea how this happened. And you have to have a bit of, you have to sort of get your balls, don't you, to post anything on Facebook online to ask for advice, or to discuss a case. And I think what happened is loads of people sort of answered, and then one very kind diplomat answered, and he said, "You probably just went through the bone plate under the eye." And I slipped off the upper teeth a couple of times, but you do, don't you? You slip and you go, and then it's fine. And it didn't feel any deeper than normal or anything like that, but I slipped, and I obviously had just a really unlucky slip. But it's been really awful, or it was really awful when I first realized what was happening. And it's all going to be okay in the end. And, but it happens. It's interesting how these things come out of nowhere, and you think it all went well. Sometimes don't you, that the ligature slips and the bit is bleeding and you've got to deal with it. And sometimes you pat yourself on the back, have a cup of tea, think what a great job you did. And 2 days later, their gods come and get you.
Yeah.
Yeah. I think I'm worse and worse actually with my self-confidence or feeling. And it can affect your performance as well. And what you said is really true in that you never know what's around the corner. And it's a horrible job that you can, like you said, feel you've done a good job. You don't know what's going to come in the next day and go, you did the wrong thing there, or you didn't do that, or you missed that. You don't get a reprieve from that burden or that fear, do you? But it's a horrible thing, a kind of cross that I feel I bear with the work that I do.
And I think the older you get, the more you know what can go wrong, whereas the naivety of youth is a wonderful thing. And also now, again, Brendan, we're going to make ourselves sound like we're 3 million years old. But back in the day, there wasn't the forums to discuss cases like this. So on the one hand, you maybe didn't learn as much as you potentially could from your mistakes, but on the other, you had no idea what could go wrong, because nobody talked about it, or you weren't sort of subject to thousands of colleagues and cases, talking about it. Like I never used to worry about bitch spays ever. So got in there, pulled my sleeves up, and we were doing them at all stages of cycles, at all ages of dogs, and the older I get, the more I worry. And I think one of the reasons, I don't know whether you would agree with this, one of the reasons I worry is because other people worry, because I see people online worrying, thinking, oh gosh, this is a big surgery, isn't it hard? All of this. And then I sort of got myself into a mindset of like, oh gosh, it is. And maybe it is quite, and they're not very pleasant surgeries. And I've wound myself up to the point where I hate doing them now. I hated them. Whereas back, as a new grad, I didn't give them a second thought. And it really, really annoys me.
I don't know. I think it makes sense though, because it is like you say, it's experiences and it's what people say that change your opinion. I'm the same as you, Kat. Like as soon as I qualified, I went into a really busy practice and I was doing bitch phase on my own on like day 4 of being qualified. So I was like thrown in the deep end quite quickly, but that's how I learned. I learned fast and I loved them. They were my favorite surgery for a really long time. And then I had one that went a little bit wrong intra-op, and she was absolutely fine. There was, it didn't affect the dog. It was a normal complication that can happen mid-surgery, and I fixed her. She was fine. She woke up, no problems whatsoever. So it was no negative effect on the outcome of the case. But since then, now I'm nervous, and you take on board. And I think before you have something happen, even if other people are saying, oh, you need to be careful of this and you need to be careful of this complication, you think, oh, well, but yeah, how often does it happen? And it's probably not going to happen to me. And, you can brush it off. But then when something does happen, the next time you do one, you think, I'm that little bit more nervous. And I think in a way, one, it makes us more careful, but also maybe it makes us not worse. I don't mean to say that, but if you're super, super nervous, you're not going to do as good a job as you would be as if you were more relaxed. But then a little bit of nerves can be the thing that gives you your edge. So it's that fine line, isn't it? We need to understand what can go wrong enough to be educating our clients and communicating with them in the way that they need to. They need to understand everything can go wrong, but not so much to the point that we're terrifying ourselves and we can't do a good job anymore. Does that make sense?
Totally.
Yeah. It 100% does. And that's sort of the sort of burden we carry as veterinary surgeons, is we are enormously autonomous. Even our medic colleagues don't, nobody's sending a 4-day qualified doctor into a hysterectomy on their own.
No.
Their job is hard. I wouldn't want to do it. And the responsibility they carry is enormous, but they're generally part of a team. And I think we talk a lot about resilience in this profession and how we have to be resilient and we must. But actually, I think that sometimes when we talk about resilience, we don't talk about what it really is. And I think what resilience is that you do that surgery, you do that bitch spay, it goes wrong. and you go and do another one the next day. You pick your scalpel blade up and you go back in again. And it's not, people talk about, and I don't know, maybe this is me being just very cynical, but people talk about how, oh, you do a euthanasia and then have to go into a puppy consult and smile. They talk about that. And I'm like, that's not hard. But maybe it's just me. I don't think that's hard. I think what's hard is the next cat dental I'll do. That's hard. I think sometimes we don't appreciate, again, it's all about this appreciation of how amazing we are, and how what we do is not normal, and what we expect of ourselves is incredibly high. And we need to give ourselves a bit more appreciation, really, of how awesome we are.
Yeah, for sure. Well, thank you very much, Kat the Vet, for coming on. We hope you've enjoyed being part of the podcast, and fingers crossed we'll have you back at some point in the future.
I would love that. Thank you so much for having me.
It's really interesting to get other vets' perspectives on these things, isn't it? We all do the same job, but sometimes we can have such different experiences and perspective. But it's nice to know that at the end of the day, we're all in it together, and everyone has had a case that they wish had gone differently. So, I actually had one recently too. Oh, it was horrible. I still don't like talking about it. I had a Canic also come in. She was where I was locuming recently, and she'd had a pyo surgery about a week before I saw her. Anyway, she turned up to the practice as she got there when I arrived. So she was there at like 8 a.m. And she'd completely eviscerated through her wound. So she had all her guts hanging out. So, we sterile draped her and anesthetized her as quick as we could. But she'd strangulated part of her intestine. So I ended up doing like a 40 centimeter end-to-end anastomosis, like a big surgery to try and get rid of all the nasty gut. And, I checked everything before I closed. I was really happy, counted all my swabs and my sharps out, was happy nothing was bleeding, closed her back up, popped her in a kennel, had her on quite a lot of drugs because she was a bit aggressive as well. So I needed to keep her calm. Anyway, I left, went home, came back in a few days later after the weekend and found out that she'd actually bled post-surgery, and she'd bled into her abdomen. And it turns out that one of the ligatures on my mesenteric vessel had slipped and it had just come off, and she'd started bleeding into her abdomen. So they had to go in again to fix the problem. And it's the first surgery I've ever had bleed post-op. I've had a spay bleed during, where I've gone to sort of tie down on my ligature and it's just cheese wide through the fat and slipped away, but I've managed to fix it intra-op. But I've never had one before where I've closed up, been happy, and then found out afterwards that somebody else has had to go back in. And that's a horrible feeling, isn't it? Especially when you're not the one fixing it yourself. It's horrible, but I'm sure we've all been there where things have happened and things can happen. Yeah, it's just horrible when it happens to you, isn't it?
Massively. Yeah. And it's so easy to focus on the thing that goes wrong rather than all the amazing things that went right, especially that was quite a complex case. And you got the dog through all of the acute, massive difficulties. But in that case, you still find it hard to talk about because you're going to focus on the negative, which admittedly in that situation, it's a biggie, but it's a big, awful thing to have to, yeah, appreciate. We are human, aren't we? It's horrible part of our
Absolutely.
job. I think as vets, we have to be so tough. I've had it too. I remember when I was very young in my career as well with the castrate as well. I feel like we're really judged by the client. Maybe we're feeling that more intensely because of the panorama. So now
Yeah.
we're even more like, what, we must be perfect.
Yeah, exactly. But I guess just a reminder, we've all been there. We all have those rubbish days. We all have those rubbish cases. But hopefully, things like this and you guys listening to us talking about ours as well. And we just need that reminder that we're all in it together. And those rubbish days, everybody else will have had them too. So just don't ever feel like you can't reach out and chat to everyone because we've all been there. So
Can I do my really slightly awful but funny story,
yeah,
actually? This happened to the vet when I was at my foster practice. I was trying to think, how much should I say then? So he was at home visit euthanasia, which is always the start of the best stories. And it was a cat. He put the cannula into the leg, and right at that moment, the cat got escaped, and it was freaking out, and it was doing wall of death around the living room, and somehow the little bung came out of the IV cannula.
no.
So the cat was doing wall of death around their living room. They couldn't catch the cat, and the blood was flicking all over their walls, their house, everywhere, until they could catch the cat and then do the euthanasia. And the guy was, yeah. Oh, the guy said, "We've put the cat to sleep. We just looked around, and it's just like blood all over all the walls."
God,
It's just imagine.
no, nightmare.
Awful.
Last thing you want to happen, hey? But
Can you beat that for a
yeah.
bad euthanasia?
awful. But anyway, okay, so roundup time. I think we've covered the Panorama episode, and we've covered ET tubes in cats, cancer blood testing. We've touched on some of the struggles that we have with mental health and cases that go wrong in the veterinary profession. But we wanted to give a big shout out to Kat the Vet for being our first official guest on the show. So thank you very much for coming on board.
We hope as ever you've enjoyed listening, and remember to get in touch if you have any comments or suggestions to help us improve these podcasts for you. Any topics you particularly want to cover.
Yes, we'd love for you to get in touch. But for now, thank you very much for listening. Join us again next Sunday for our next bonus episode, where we'll be taking a deep dive into dyspnea cases in small animals, covering everything from presentation to exam, workup and treatment options. Until then, it's bye from me.
And bye from me. Take care. The content presented in the Chatty Vets podcast is intended for licensed veterinary professionals and is for informational purposes only.
Views expressed are those of the host and guests and do not substitute for clinical judgment or individualized patient care.
Drug dosages, protocols, medical advice discussed should be verified against current literature and manufacturer's guidelines.
Class and its creators are not liable for any errors, omissions, or adverse outcomes resulting from the application of this information.
Always consult relevant laws, regulations, and institutional policies in your practice. Listener discretion is advised.